Hey there, have you heard about the new international guidelines for managing polycystic ovarian syndrome? As someone who's been diagnosed, these guidelines contain a ton of useful info you need to know. They were developed by leading health organizations across 6 continents. It's a 270-page report, and it provides evidence-based recommendations on everything from diagnosis of PCOS to treatment of PCOS. The guidelines address major impacts of PCOS, like body image and quality of life too. For instance, they recommend screening all women with PCOS for mood and eating disorders, since these conditions are way more common in women with PCOS. The guidelines also use inclusive language, avoiding terms like overweight and obese. Instead, they say higher weight and emphasize offering all patients the best care regardless of weight. So if you want the full scoop, then keep watching to learn key takeaways from these groundbreaking PCOS guidelines. So let's go ahead and get started with the first key takeaway, which is how PCOS impacts mental health and body image. The guidelines emphasize that PCOS can significantly impact a woman's body image and quality of life. There is an increased risk of eating disorders and disordered eating with PCOS, regardless of weight. Anxiety and depression also tend to be more common in women with PCOS. In fact, nearly 40% of women with PCOS experience anxiety, and 64% experience depression. Mood and eating disorders tend to be even more likely in Black women with PCOS, according to scientific research. The updated PCOS guidelines emphasize the importance of both physical and mental health, because women with PCOS have a higher risk of anxiety, depression, and eating disorders. So the guidelines recommend screening all PCOS patients with these conditions, as they can significantly impact quality of life. Making mental health a priority will help women better manage their symptoms and feel in control of their health. So the next key takeaway in these guidelines is pregnancy and postpartum depression risk. Women with PCOS also have an elevated risk of postpartum depression. The guidelines share that healthcare providers should screen women with PCOS for mood and eating disorders at diagnosis and then regularly thereafter. And that goes for pregnancy and postpartum. Now let's move on to the next guideline, avoiding weight stigmatizing language, because weight stigma is very prevalent, unfortunately. The guidelines acknowledge that weight stigma is common in the PCOS community, and patients should be asked for permission before being weighed. And their healthcare providers should avoid using terms like overweight or obese. Instead, what the healthcare providers should say is they can use more inclusive terms like higher weight. They recognize that weight stigma is common in the PCOS community, and that a patient's permission should be obtained before weighing them. Let's move on now to the next international guideline for PCOS, and that is to provide inclusive care. The guidelines recommend that all patients receive high-quality care regardless of weight or other factors. And this includes having size-inclusive medical equipment and office furniture available for patients of all body types. Now let's move on to the next guideline, and this is one of my favorites. This one is lifestyle interventions remain key. While medical interventions are important, lifestyle changes remain as the first-line treatment for PCOS. Scientific research shows that diet, exercise, sleep, and stress management have significant benefits for both metabolic and reproductive health in women with PCOS. According to research, losing just 5 to 10% of body weight can help regulate menstrual cycles and increase fertility. And what helped me whenever I was dealing with my PCOS was eating an anti-inflammatory, low glycemic diet, such as fruits, vegetables, nuts, foods that are high in omega-3 fatty acids, such as fish and walnuts. These types of foods can reduce inflammation, and they have a low impact on blood sugar levels, which are often elevated in women with PCOS. So the next guideline is addressing weight stigma and disordered eating in PCOS. If you have PCOS, the chances are high that you've dealt with weight stigma and disordered eating at some point. The guidelines recognize this, and they aim to provide recommendations to healthcare professionals on how to properly support you. Another guideline for PCOS is screening for mood and eating disorders. Research shows that there is an increased risk of anxiety, depression, and eating disorders in women with PCOS. So the guidelines recommend that all patients be screened, like I said earlier, and this will help identify issues early on so that you can get the help and support you need. Next, let's talk about promoting body positivity and providing size-inclusive care. To provide the best care for all PCOS patients, regardless of size, the guidelines recommend that healthcare professionals offer size-inclusive office furniture, medical supplies, and approach. The goal is for every patient to receive the highest quality assessment, treatment, and support. Living with PCOS often means dealing with unwanted changes in appearance and self-esteem issues. The guidelines encourage doctors to be sensitive about weight and use inclusive language. Asking permission before weighing patients and providing size-friendly medical equipment are ways to create a supportive environment. The guidelines also recommend offering the same high standard of care regardless of a patient's size or weight. Now let's move on to the next guideline, and that is considering the impact on well-being. So the feature of PCOS can significantly impact how you view yourself and your quality of life. Healthcare professionals are advised to consider how PCOS may be affecting your mood, body image, and risk of disordered eating. But by screening for these issues and providing the necessary support, your overall well-being can be improved. The guidelines aim to reshape how the medical community approaches and cares for women with PCOS by addressing weight stigma, providing size-inclusive care, and properly screening for mental health issues. The well-being of all PCOS patients can be better supported. You deserve nothing less. Now let's move on to the next PCOS guideline, improving access to care. Minority populations face more barriers to receiving a PCOS diagnosis and treatment. The guidelines call for increased education and resources for both patients and physicians to address healthcare disparities. Improving access to care will allow more women to understand their condition, manage symptoms, and improve their quality of life. And here we are at the last international guideline for PCOS, and that is empowering patients. A PCOS diagnosis can be overwhelming, but patient education and support are key to empowerment. The guidelines recommend providing clear information about causes, symptoms, and treatment options to help patients make informed choices. Lifestyle changes, medication, or therapy may all be part of a comprehensive treatment plan developed in partnership between patients and their healthcare providers. Patients should feel equipped to advocate for their needs and play an active role in their care. The updated PCOS guidelines take a holistic view of health that considers both medical and psychosocial well-being. By focusing on patient empowerment, promoting inclusiveness, and improving access to high-quality care, the guidelines aim to help all women with PCOS live their best lives. So there you have it, ladies, the latest international guidelines for PCOS, a huge collaborative effort from experts around the world to help you get the best care and support. There's a ton of info in there, from diagnosis to treatment options, mental health to lifestyle changes. The key for you is to find a doctor willing to follow evidence-based recommendations, one who screens for mood and eating disorders and doesn't just focus on your weight. You deserve compassionate, comprehensive care. These guidelines are your guide, giving you evidence to back up what you need. Now go out there and advocate for yourself. You got this. And one last thing, ladies, I have an online nutrition course that has helped many of my PCOS sisters. It has video lessons, handouts, and so much more, so that you can lose the belly fat, reduce your PCOS symptoms, and feel so much better without cutting calories and giving up your favorite foods. So go check it out. The link is in the description box below. Thank you so much for watching, and I'll see you in my next video.